Okay, this video is a tale of two cardiac patients, okay? So this is two very common scenarios. I've seen both of these scenarios many times, okay? I've actually seen the first one much more than the second one. So the first patient is Mr. AFC. AFC means average frustrated chump. And he's about 50 years of age. He's got some tightness in his chest. He knows he really can't exercise much. His chest tightens up. He gets some pain, dyspnea on exertion, shortness of breath. So, he's kind of a macho man. He's proud of his carnivore diet. He says he eats meat like a lion does. He thinks his beer belly is a joke. In reality, he looks like a pregnant female. And he thinks his man moobs, are a joke. They're like gynecomastia. They got female breast tissue development. I'll see that on CT scans. Also, his Johnson isn't working so well, and his wife's been making fun of him. But, so what? He'll just take some Viagra. It's no big deal. Okay, so, he decides to go to a cardiologist. Cardiologist sends him for a stress test. McDougall calls a treadmill stress test, a conveyor belt to the operating room. The cardiologist does recommend a cardiac cath. They put him on the cardiac table. An angiogram, you run him up through the common femoral artery in the right groin, up into the heart, and then they inject contrast to opacify the coronary arteries. That's a cardiac cath. Coronary angiogram, same thing. Then they see a narrowing, a stent, a narrowed artery, and so that's called the oculostenosis reflex. Oculo meaning you see a narrowing, a stenosis, and you put a stent in, okay? Cardiologist gets $30,000, the whole billing fee for the stent. But they tell him, the stent could only fix one part. There's other blockages that are in a bad spot they can't fix with a stent. They call it a widowmaker, and they say he's going to have to go for open heart surgery. They tell the patient, no discussion, you've got a widowmaker, don't mess around, you got to go open heart surgery. We're going to recommend the best heart surgeon to you. I went through this with my father, and I tried to talk him out of it, but I didn't know enough at the time. That was many, many years ago. So then they recommended for CABG. CABG, it's pronounced CABG. It means coronary artery bypass graft surgery. I slept with my father in the ICU after his surgery, and he went to the best guy in the area, and he came out of it okay. He was incredibly hypotensive post-op. I forget the exact pressure they were running him at. It was something like 90/60, really low. I called the anesthesiologist over there, and they said, well, we got to run his blood pressure low because we don't want him to bleed at the anastomosis. That's the plug-in sites of the bypass graft. By the way, to do open heart surgery, they take a buzz saw, a rotating circular saw, cut open the sternum. They'll drop the left anterior descending, they'll drop the internal mammary artery down to the left anterior descending. That's called a lima, left internal mammary artery to the left anterior descending. Lima to the LAD. They'll take a vein off the leg, greater saphenous vein. They'll cut it into pieces, rotor out the valves, and they'll use them to do bypass, reverse saphenous grain vascular bypass from the vein to use for the coronary artery bypass grafts. And that's why Simpson says I had a single CABG, a double CABG, a triple CABG. They're talking about 3 bypass grafts. Okay, so anyways, pretty fancy stuff. All the while he's on a heart-lung bypass machine, pumping blood because his heart's been stopped, with the cardioplegia solution. Okay, anyways, after they run him hypotensive, for over a day, they notices when he starts waking up, that he's slow. He's mentally slow, and a significant number of patients have cognitive impairment from open heart surgery. He also, for whatever the reason, has a little trouble coming off the vent. His heart's not pumping so well. He's got a bit of congestive heart failure, so his lungs are a little wet. Wet lungs, pulmonary edema, congestive heart failure. So, he just can't come off the vent effectively. So he stays on the ventilator a prolonged amount of time. They say, screw it, we can't leave this endotracheal tube in for such a long time. We have to do a tracheostomy. So they cut a hole in his trachea. It's a shorter length tube, and they run the ventilator through there to keep his lungs oxygenated, at high percentage oxygen concentration from the ventilator air. He also had a small stroke. Patients sometimes have a small stroke. And he can't even eat safely for a while because of the stroke. He can't protect his airway. They're afraid he's going to aspirate the food into his lungs. So they put in a G-tube, a gastrostomy tube. It can be done with endoscopy. It can be done with open surgery. But he needs a G-tube for feeding, gastrostomy tube. Okay, a feeding tube put directly into his stomach. We usually call him a G-tube. Stomach is gastric, so it's gastrostomy tube. Okay, they've also got these electrical wires still coming out of his chest. I call them epicardial pacemaker wires. They also have a temporary pacemaker ready if they need to put it in, but they need to keep those a while. They're not confident yet his heart is stable enough that they can remove those epicardial pacemaker wires. Also, where they sewed open his chest, he had a bit of an infection there. You know, they weren't able to get it to close the way they wanted, and it's got a bone infection called osteomyelitis. So they'll put in a PICC line in his arm. Oh, I spelled it wrong. It's PICC, PICC line, peripherally inserted central catheter for antibiotics. And so he's a bit of a MOG. Okay, a MOG is multi-organ failure. He's got a bit of heart failure, congestive heart failure, CHF. He had a little bit of kidney failure, ARF, acute renal failure. He had a bit of a lung failure, respiratory failure, and his brain's not working like it was. You can call that a BF, a brain failure to some mild extent. And so then he saw Dr. McDougall's lecture on the internet saying that stents and CABG have a 0% ability to prevent future myocardial infarction and heart attacks, and a 0% increase in all-cause mortality, longevity. So he's a little pissed off, okay? And now let's go to our other patient, patient number 2. So patient number 2 is a little bit of a wiser person here, but, you know, he's still screwed up. He's having cardiac angina, tightness in his chest. He's also about 50 years of age. And he goes and starts learning about coronary arteries, and he realizes he effed up. It was his fault. He screwed up. He used to eat the SAD diet, meat and oils, Mediterranean diet, all this stuff that chumps do. And it's his own fault. That's a good thing to accept it as being your own fault. If it's your own fault, there's a more likely chance you can fix it. So he starts watching nutrition and health videos online for free. And he especially studies the work of Caldwell Esselstyn, reversal coronary artery disease. He then, goes low fat, low sodium vegan with no oils, and he lowers his total cholesterol to below 140. He starts optimizing his body weight. And the Johnson flag is now, again, flying in full mast. His wife's a little annoyed because he's starting to want to bang her every day, and she's pissed off because he thinks he's some type of, newlywed or something all over again. Haven't you been through that? You know what the old saying is about marital sex? If you took a jelly bean and put a jelly bean into a jar for every time you had sex during your courtship phase and during your first year of marriage, the rest of your marriage, you would never finish emptying out that jelly bean jar. Unfortunately, a lot of marriages are like that. But anyways, now he's getting a little bit too frisky, and he's kind of starting to annoy the wife. Okay, she's considering pushing. We definitely need separate bedrooms routine on him now. He's middle aged after all. She's had to take care of the kids all these years. She's done her share. She doesn't want to have to put out every day all over again. Enough of that. Okay, so that's causing a little bit of a marital friction. He goes to the grocery store, and he sometimes gets a little frustrated at the grocery store. He's not sure what to buy. He has to keep reading about foods and menus, and it's taking a lot of his time. He's busy at work, so that's a little bit annoying and frustrating. He's lost so much weight that he has to now buy some new clothes, so that's going to cost him some money and some time. It's a pain in the ass going to the store. Guys, we don't like going to clothing stores. It's annoying. And for a whole month, as he's been changing his diet, off and on, especially when he's eating sort of 50-50, old way and the new way, he really had the farts a lot, and that was kind of socially embarrassing. He's not happy about that. He got embarrassed about that at work a couple times, and he even hershey squirted his underwear a few times, so he's a little pissed off. So the point of this is, look at the problems. Okay, this poor dumb bastard, he's basically destroying his body. He's in multi-organ failure. He's accelerated his arrival at dementia, stupidity, and death. This other guy's a little pissed off because he had a Hershey squirt in his pants, and that sort of thing. So what I'm trying to say is, these are the two, and this guy will have increased longevity, lower risk of hypertension, lower risk of myocardial infarction, lower risk of diabetes. His side effects, other than Hershey squirting his pants a few times and the wife being a little annoyed with him, they're good. All right, this guy, he's got major problems. And don't get me wrong, there's some CABG patients that come through it a lot better than that, certainly, but it's sort of like, why take the risk of all this crap when you have a more effective treatment with no risk and no cost? Okay, he's going to potentially end up bankrupt over here, this poor chump. So anyways, there it is, a tale of two cardiac patients.